The county of Makueni has been described as the epitome of best practices in the principle of devolution, as espoused in the Constitution of Kenya 2010. Under the tutelage of founding Governor Professor Kivutha Kibwana and his deputy Adelina Mwao, the county government of Makueni has set the devolved unit well on its way to being a model county, setting standards for the rest of the country.
We should try to have a system of economic empowerment, and that basically was about value addition, so that we would take the things that people are already doing and see how to upscale them. So I can say, I feel in terms of laying that foundation, I could say that we have done maybe 60 to 70% of laying a foundation, and that really was what I came to do in Makueni.
Coming from a rich academia and civil society background, Governor Kibwana enjoyed a special understanding of the kind of leadership the counties needed from the onset.
Three most important things that I can say so far have happened to Kenya. Obviously, the first was independence in 1963. The second momentous happening was the 2010 Constitution, and within it, embodied in it, devolution.
Through a robust public participation program, the county government of Makueni engages its citizens deeply and involves them in all development projects right from the ward level.
The involvement of citizens in their development is one of the biggest challenges actually on the continent, because most of the people are invited to vote. Many times even the vote is not genuine, and for 5 years or whatever period it is, they are bystanders in the development of their country. So the 2010 Constitution was very clear that citizens were to be involved in their development, because it's only when that happens that there is sustainability, that they own their development programs.
One of our biggest achievements in budget making is being able to talk to the people through what we call participatory budgeting, and being able to discuss with them what needs to be done, and talking to them about their challenges and them suggesting possible solutions. Then sitting together and being able to conceptualize what kind of a project will address the challenge that the people have.
Gavana wetu alisema kila jambo likitimizwa lazima wananchi waketi chini wasungumzie hiyo vitu vyote. Kwa hivyo tukaitwa mkutano huu unaitwa hiyo kwa jina la Kizungu, siwezi kuitamka. Tukaja ili tusikize miradi serikali sema itatimiza.
In every project that we do, like now the over 500 hard projects that we're doing, the community congregates together. They elect a project management committee that manages that particular project, and our technical people and also the contractors, they have to share the BOQ of that particular project, the cost and what have you. And for you to get paid of your monies after doing the job, they still have to write a report and say, other than our technical people certifying that we've done a good job, they still have to write a report and minutes, and they sign against the report that they are certified with what the contractor did. And you can't get paid unless that report is there.
We decided that we were going to form a people's government to supplement the national government and the county government, and we were going to form it from the village upwards. And we have, I think that is 643 villages, and those have a forum where every villager can come, and during their palavers, they're able to discuss anything that they want. They can discuss the question of alcohol, drugs, teen pregnancies, whatever it is that they want to discuss. I think it's important for the people of Makueni to always bear in mind that the government is their property. It is their government. The development is their development. And the leaders are facilitators, and they must always strive to have leaders who will work with them, leaders who will be servants and not bosses.
Closely linked with the Office of the Governor, the Department of Devolution, County Administration, Public Service and Youth is a key component of the Makueni County Government. This docket pays special attention to the youth. Makueni is one of only 2 counties in the country with a fully developed youth policy. The county government of Makueni has established a program known as Ajira kwa Vijana, which is geared towards integrating jobless youth in simple road maintenance works in a bid to put money in their pockets.
And every project has to have an allocation of 2 youths to be recruited to be part of the implementation process. What we do is we recruit them in terms of they are the skilled and unskilled, and we pay them 10 for the unskilled and the skilled 15,000, so that they learn how projects are done. Other than learning from school the theoretical standpoint, they now learn how to do it.
We wanted them to do real things, not just to cut bushes and then after a short while they grow again. So we wanted them like to do even roads for water, and that really helped a lot. Where there is a road and then the adjacent families to the road begin to get a furrow so that they can do irrigation. That helped, a lot. And of course the youth would get money themselves, and even some youth would get money and begin to go into business. We also worked with the First Lady on the highway. She works with groups that are very underprivileged, groups with, who are into drugs, groups who may be in commercial sex work and so on, so that again we can see whether people can get out of those habits.
Ujuzi Teke Teke is another program by the Department of Devolution, County Administration, Public Service and Youth, targeting young people who have skills but lack certification and basic knowledge in various fields.
We have come up with a system where we identify masters, people who are, for example, well-accomplished masons, and then we tie them, the master and the student. And the master helps that student to get accomplished in terms of the area of specialization. It's a program which is taking 2 months and which we are supervising. And after the 2 months, if one is a mason, the county comes forward and supports them with some basic tools of becoming a mason.
The Makueni Youth Apprenticeship Program is yet another platform for the youth through which job seekers are attached to various county projects to gain knowledge, skills and experience.
We've been able to reach over 500 apprentices. What we do, we advertise based on their skills, they apply and they are recruited by the County Public Service Board together with the department. And the scope of any projects goes for not more than 4 months.
The county government has also instituted a program aimed at equipping border operators with road safety knowledge as well as seed capital to fund and boost their businesses.
We've already trained over 8,000 and licensed over 8,000 border riders, and we also train them on savings, so that as they do their border thing, they still save a shilling in a day, so that it goes to help them in their long-term future. That is one of the programs that has really helped transform the youth.
All of us talk about the youth being deprived, the youth being unemployed and all that kind of stuff. But when it comes to the concrete things that we do with the youth, and not just meetings and conferences and talking, but real things, so that the youth can say, I have put some money in my pocket and I'm doing that consistently. That's the challenge. And that's why we started working with the boda, helping them to begin to buy to buy the motorcycles, because many of them ride motorcycles owned by others. So we began that project in the 30 wards, and we formed them into a cooperative. They started also saving a bit, and they even began to buy their own motorcycles. And actually, one of the circles have even gone into buying lorries to carry water.
The department has also put in place an industrial training program for housing construction in partnership with the National Construction Authority, NCA, and the National Industrial Training Authority, NITA. This project has helped more than 3,000 construction workers so far.
We recruit the masons, the fundis who work around the county, and then we train them on a new construction technology. And NITA certifies them. Like currently we are training them on the new technology on doing tiling. And I think we've done about 3,000 construction workers across the county.
The department also boasts of the Makueni Youth Agripreneurship Program that helps youth groups in agriculture, as well as the Tuliajiri program that is being implemented in conjunction with the KCB Foundation. All these programs are carried out only after extensive public participation.
If there is a contractor, for example, who is doing a dam, the PMC is given information on the project, and they work together, so that even when the contractor is being paid, they will sit down and look at the project generally from a mwananchi point of view, not from a technical point of view, not from an engineering point of view. And they can say, if it's a classroom, for instance, the classroom has already been roofed, and that information is corroborated with the engineer's report, and that supports any payment which is being done to such a contractor.
Health is one of the main functions devolved to the counties, and the health picture in Makueni has changed tremendously since the inception of devolution back in 2013. The county government has boosted the number of health facilities in the county from a paltry 107 in 2013 to 237, including a state-of-the-art county referral hospital in the county headquarters, Wote, 11 level 4 hospitals equipped with a total of 14 theatres, a 200-bed modern maternity hospital, an oxygen plant, and a well-equipped trauma centre at the Makindu level 4 hospital.
Since independence, Kenya and many African countries have only been investing heavily in curative services. And a lot of money is pumped into curative services, and every other subsequent year, you have more money having to be allocated to treat sick people. But as Makueni, we realized that that was not the way to go. So we revamped our community health strategy, made sure that every health facility in the county is attached to a community unit, and we have been forming community units over the years. Currently we've formed more than 50 new ones, and just taken stock of the people who have been community health volunteers. What training have they been receiving over the years? Where are they attached? And so we have been retraining them, and we are using them very, very elaborately to go to the communities and do health education, make sure that the children who are there are fully immunized, make sure that pregnant mothers who are in the villages, they are not going to deliver in the traditional birth attendance place, they are coming to our facilities. Make sure that people with the HIV, TB, they are taking their drugs well. And so all these interventions at the community level have really helped us even to improve our indicators so that fewer people need to actually come to receive their drugs. We are not in that when you invest more in the preventive health services, first you're keeping more people healthy so that even the socio-economic activities that they've been engaged in are amplified. Because when somebody is sick and they have to come to hospital, they have to be admitted, they lose some time out of their work, out of their families, out of their social issues, and that has been a problem. So basically, when you scale up the preventive health services, we are also noticing that the healthcare system costs are going down.
The county of Makueni is a proud pioneer of the Universal Health Coverage Program that has also been adopted by the national government.
The idea of just paying 500 shillings for a family and first of all making sure that those who are 65 and above don't pay anything. And they get all this treatment. I think that really was a very, very, very important thing to do. And even at the national level, the idea of UHC, I think one can say it has roots from Makueni. And recently, the national government asked us for the minister for health to go and work at the national level, so that we seconded him to the national level. For me, it might be a good idea if even when there is a national level system, because the national level system caters for only some of the people. Like in Makueni, we were asked to provide about 30,000 people, 30,000 families, and we have about 250,000 families. So there would still be poor families which are not provided for in the national UHC.
The famous Makueni Care Health Coverage Initiative is the county's flagship health project, where more than 250,000 families can access health services for only 500 shillings each per year.
And this cover was really, really generous. We would cover all the lab services, we would cover outpatient services, we would cover inpatient services. Even when somebody had an operation done on them, the card would cover them. They would get drugs and lab services, radiology services from that package. And the reason why the package was that generous from the word go is because before our initiative, only about 8% of the residents of Makueni had insurance. So it was really a challenge for us to make people understand this concept of prepayment for health. And with that generous cover, they have actually been registering, and currently about 100,000 households are registered into the program.
Adjacent to the Makueni County Referral Hospital is the Mother and Child Hospital, a 200-bed modern, specialized standalone maternity facility.
We have an NBU, which is manned by a pediatrician. We have 2 theaters domiciled in that facility so that we can operate at least 2 mothers at a go in case there is need. We also have a gynecologist who is manning the facility. And of course, that is where even MCH is happening, Mother and Child Clinic, so that when our mothers come there, we are able to have them through a good experience, because the hospital does not deal with any other ailment. It is just matters of delivery and gynecology.
This hospital has made life easy for mothers across Makueni's 6 sub-counties.
Huduma za hii hospitali ni nzuri, zimepita hata kiasi, kwa sababu wakati unapokuja na tatizo fulani wanakushughulikia na wakawii. Hivyo basi tunashukuru huduma zao sana kama wamama.
Upande wa malipo unatumianga ile kadi ya Kivutha Kibwana ama Linda Mama.
The facility's accessibility has improved general access to maternity health care in the county of Makueni.
We normally have 120 beds for the mothers and 80 for the newborn unit. So at one point, the highest we normally have it's between 70 to 90, but it's a season. So in February, in May, we have high numbers. We even actually, on our every month, average month delivery, it's between 250 and 299.
The Mother and Child Hospital was meant to be like a hospital within a hospital, because the water referral hospital is a big facility, but we wanted a specialized hospital for mothers to deliver in, and for children, the small children. And I think it has been a big success, because all classes of our women folk are able to deliver there, including workers in our government.
We have a better capacity to serve the whole county. Because you see, this is the referral hospital. So we receive referrals from other level 4 facilities and even level 3 facilities. So if there is need, this facility has done good job to the Makueni County citizens.
This is the Makindu Level 4 Hospital, situated along the busy Nairobi-Mombasa highway. Inside the hospital is an ultra-modern trauma center equipped with CT scan machines and a twin theater that has made it possible to serve the people of Makueni, as well as neighboring counties of Kitui, Kajiado, and Taita Taveta.
We have one of the best surgeons around, orthopedic surgeons. We are able to do knee replacement, total knee replacements. We are also able to do total hip replacement, and any patient needing those services is able to get the services anytime.
This is a specialist surgical hospital where we are able to do surgical operations, where we fix bones, and within a short time somebody is able to have their implant, and the orthopedic surgeon there is currently doing knee replacements and other procedures that previously have been done in the private sector. And so we want to actually establish our county as a medical tourism destination for other counties, that people can come, and instead of going to places abroad, we are able to do that here.
The establishment of this trauma center has been lauded as futuristic, as it also serves to treat accident victims on the Nairobi-Mombasa highway, being the only such facility between Voi and Machakos.
And there are so many accidents happening around here. Border riders, motorists along the Mombasa-Nairobi highway. Those who come along, who get accidents here, are all rushed to the hospital. We have ready ambulances whereby we rush for patients wherever we hear that there are accidents. Wherever we are, we are able to offer services to other surrounding counties such as Kitui South, Kajiado East, even Taita Taveta.
Automation of health services in the county of Makueni has helped increase effectiveness and turnaround time. It makes it easy to deploy the county's fleet of ambulances efficiently.
We are using biometric so that nobody can beat the system by just coming with a card, and they say, the card could be forged. They have to put their finger so that we say this is somebody from a household that is registered with us. Our hospitals have a health management information system from the outpatient to make sure that all the people that we see, we can keep their records.
The county of Makueni is a leading horticulture zone in the country, famed for producing the best mangoes and oranges in the Republic.
Agriculture is critical to this country. It's critical to the county because most of our people actually depend on agriculture for their livelihoods. Actually 70% or more than 70% of our people depend on agriculture for their livelihoods. It also contributes about 47% of the GDP for this county.
Since 2013, the Department of Agriculture, Irrigation, Livestock and Fisheries Development embarked on an ambitious value addition journey which has now borne fruits.
The hilly areas will be suitable for horticulture, where they will do French beans, like areas of Mboni, Kilungo, Bitini. You'll do dairy, will even be more sustainable there. Although we still have dairy in the hotter areas and lower areas. Indigenous chicken can cut across, so they'll still do indigenous chicken. Then there's the middle zones, the middle level rainfall, where we'll start doing fruits, the citrus fruits, including mangoes, and we are the biggest producers of mangoes as a county in the country, producing almost 30% of the mango that is produced in this country. We've got some of the best other citrus fruits, pixies, oranges. Then the lower area that now we promote, especially now the pulses, the green grams, the cowpeas, pigeon peas. Those are the areas from Kalawa, part of Makueni'S, up to Mtitwande.
With a plan to fully commercialize mango farming, the Makueni County government established the Makueni Fruit Processing Plant at Kalamba as a vital value chain aimed at minimizing post-harvest losses and providing farmers with a steady market.
It's famously called Kalamba Fruit Processing, and the goal was actually to provide alternative markets for mangoes, and in future you should be able to even process other fruits, to also stabilize the prices and to reduce post-harvest loss. That was the goal of coming up with the Makueni Fruit Processing Plan. That is exactly what we are doing.
In one of the first public participations, people said that they wanted their mangoes taken care of, because they used to get as low as 3 shillings per kilo, maybe sometimes 2, sometimes they would throw away all the mangoes. So this is when we came up with the fruit processing plant at Kalamba. We do puree and we sell the puree, although again during this COVID time it has not been as easy as before to sell puree. But fortunately we now have finalized our capacity to do juices. So from the puree that we have, we are going to do juices.
To boost the earnings of farmers in the drier parts of the county, the Makueni County government has put up this grain processing factory in Makindu as a critical value chain for farmers of green grams, cowpeas and pigeon peas and other pulses.
We've supported farmers from the starting of devolution through giving them certified seeds, because we've got to get it right from production. So we've supported them by giving them certified seeds so that we've got clean material that will give you a good yield. Again, it's always important to add value so that the farmers get better value for their money. And we've come up with, the county has come up with 2 plants. One is in Makindu for grain processing, where we should be able to receive raw materials, process them, clean them, distone them, and pack them as clean produce ready for the market.
Residents have expressed their satisfaction with the grain factory project through the project's management committee.
Vile walituletea mradi, tuliweza kujulishwa ya kwamba tukilete hapa, tuseme hiyo pesa tunapewa na broker, tuseme 50, tutaweza kuipata. Kutoka hapo hiyo nafaka itasafishwa iende na value iko juu, ndiposa ikienda kuuzwa either kwa market, pia mkulima ataweza kuletewa a certain percentage ya bonus. Sasa utapata ile bei tulikuwa broker ananunua, sasa kuna pesa nyingine iko juu.
Pulses generally, not just green grams, so that we can sort them, we can clean them, we can pack them. We can do all those things. So that is again a value addition.
The county government has established a second grain plant in Kasikeu for milling and packaging produce. The county of Makueni produces 58,000 metric tons of green grams per year. The department has also sought to boost dairy milk production in the county by supporting more than 14 dairy cooperative societies and putting up 2 mini processing plants.
We've got 21 self-help and cooperatives, and we've supported 14 in the various ways that I've mentioned. From that, we've been able to access markets in supermarkets, ATMs, including selling to places like KCC. And that has reduced a lot of post-harvest loss and given our farmers better prices than hitherto before the counties came and supported dairy production.